Obstructed labor. Labor is to be obstructed when descent of presenting part is arrested because of mechanical obstruction despite having good uterine contractions. The causes are cephalopelvic disproportion, contracted pelvics, soft tissue obstruction like cervical dystocia, tumors, previous operative scare, presentation of fetus, transfer line, congenital malformation, big baby or microsomia, locked twins, Bandel's ring. The signs and symptoms are prolonged labor, strong painful uterine contraction, dehydration of mother, distended bladder, formation of Bandel's ring, absence of fetal heart rate or fetal distress. Management is early diagnosis of case through the partograph, rehydration of mother for correct electrolyte imbalance, cesarean section, assisted delivery if appropriate, administer antibiotics to control infection in mother. Didelphic uterus is also known as double uterus. It is a rare congenital abnormality of female reproductive system. Here, uterus developed as a two separate structures instead of one, and each uterus has its own cervix, and in some cases each may also has own vagina. Endocrine system changes during pregnancy. Follicular stimulating and luteinizing hormone inhibited during pregnancy. Thyroid gland enlarges. Basal metabolic rate increases. Untreated maternal hypothyroidism leads to maternal retardation in fetus. Fetus start producing thyroxine at 11 to 13 weeks period of gestation till fetus depends upon maternal thyroxine, and adenocorticotropic hormone and cortisol increases. Hyperinsulinism occur if mother is diabetic. Human chorionic gonadotropin secreted by syncytiotropoblast cells of placenta during second week of pregnancy and maintains corpus luteum during first trimester, and it is responsible for first pregnancy test. Estrogen and progesterone hormones increases, and thyroid and parathyroid gland activity also increases. Placenta. Placenta is a circular disc attaches to the uterine wall. Human placenta is discoid in nature. It means disc or circular in shape. And human placenta is deciduous. It means shed after pregnancy, and it is hemochorial. It means lies in direct contact with maternal blood. The diameter of placenta 15 to 20 cm, weight of placenta 500 grams, and thickness at its center 3 cm, and placenta weight proportion to baby's weight is 1:6. Volume of blood in mature placenta is 500 ml, 350 ml from fetal blood and 150 ml from maternal blood. It has two surfaces, fetal surfaces and maternal surfaces. Fetal surfaces form 4/5 of placenta, and maternal surface form 1/5 of placenta. It develops from chorion frondosum. It develops from decidua basalis. It is covered by amnion with umbilical cord. It has almost 15 to 20 lobes called cotyledons. And do you know the placenta is attached to the upper part of the body of uterus anteriorly or posteriorly with equal frequency. After birth, the placenta separates through decidua spongiosa. If we take a section of placenta from inside to outside, it shows amnion, then chorionic plate, after chorionic villi, intravenous space, decidua, last myometria. Twin-to-twin transmission syndrome is a serious pregnancy complication, happens in identical twins who shares one placenta, that is monochorionic twins. Here the blood flows unevenly between twins, nothing but one twin gets more blood, other twin gets less blood through their shared blood vessels. And as we discussed, one baby becomes donor's twin, gives away too much blood, and other becomes recipient twin, get too much blood. And here you learn how it affects on each twin. Donor twin has low blood volume, anemia, less urine, low amniotic fluid, poor growth. And recipient twin has too much blood, polycythemia, too much urine, excess amniotic fluid, heart strain, and risk of heart failure. We can observe symptoms in the mother: a rapid increase in belly size, abdominal tightness or pain, shortness of breath, early contractions. And the treatment: close monitoring of the mother, amnioreduction, the process of removing excess amniotic fluid, and fetoscopic laser surgery is the best treatment for twin-to-twin transmission syndrome, and follow early delivery if babies are immature enough. Multiple pregnancy. Multiple pregnancy is the pregnancy where more than one fetus simultaneously develops in the uterus. So here you see the forms of multiple pregnancy. If uterus carries two fetuses, called twins, and this is a commonest multiple pregnancy. And if uterus carries 3 fetus called triplets, 4 fetus called quadruplets, 5 fetus called quintuplets, 6 fetus called sextuplets. So here you see the classification of dizygotic twins and monozygotic twins. Dizygotic twins also called binovular or fraternal twins, and this is the commonest one. Can see in 2/3 of all twins. It formed by fertilization of 2 ova, and these dizygotic twins also called non-identical twins. And next one, monozygotic twins also called univovular twins, and here the twins formed by fertilization of single ova, and this is a less common, can see in 1/3 of all twins. Diagnosis of pregnancy. Pregnancy can diagnose under 10 lunar months or 9 calendar months and 7 days or 280 days or 40 weeks. Do you know it is calculated from the first day of last menstrual period, and ovulation and fertilization occur 14 days after the last menstrual period in 28 days cycle. So gestational period can be calculated by subtracting 14 days from 280 days. Shape of uterus according to time. At non-pregnant or early weeks of gestation, it is in pyriform shape. At 6th week, it is in hen shape. At 6th week, it is in hen's egg shape. At 8th week, it is in cricket ball in shape. At 12th week, it is in globular or size of fetal head in shape. At 28th week, it is in pyriform or ovoid in shape. At 36 and beyond, it is in spherical in shape.